Hello and welcome to ImplanTalk. I'm Dr. Rashi Gupta. I'm the practice principal of non-dental aesthetics and implants. And today it's my great pleasure to welcome Professor Sormani Queiroz for a conversation. Professor Dr. Sormani is a distinguished oral and maxillofacial surgeon from Brazil. He's internationally recognized for his expertise in Piezosurgery, all-on-X implants, Zygomatics, and facial aesthetics as well. At ImplanTalk, our goal is to bring meaningful conversations, clinical insight, and real learning to dentists all over the world who want to grow in implant and surgical dentistry. Today, we'll be speaking about Professor Dr. Sormani's journey, his philosophy on surgery, and his thoughts on what it takes to deliver excellence in complex implant dentistry. Professor Dr. Sormani, thank you so much for joining us.
Thank you very much. It's my pleasure.
For those meeting you for the first time, can you tell us a little bit about your journey into oral and maxillofacial surgery?
Thank you for the opportunity to talk about my work. I finished my dental school in Brazil many time ago. I'm not that young, but in 1994. And then I went to São Paulo State University, where I did my residence program in oral maxillofacial surgery. After that, I did my PhD in oral maxillofacial surgery. And when I came back to my city, which is in the northeast of Brazil, it's Fortaleza, I started teaching in the public university there, in dental school at the grad level, and I started working in hospitals as a maxillofacial surgeon, etc. Gradually, I started to migrate to the dental implants field. Mm-hmm. I started to be passionate about rehabilitating the smiles and the lives of the person, and I started focusing more on dental surgery, on dental implants. And of course, being a oral maxillofacial surgeon, I started focusing on the bigger case, on the toughest case, and naturally, I migrated to treating atrophic jaws, the really atrophic jaws. And I'm really passionate of this with this field, and I specialized in treating these cases in my office and etc. And now I'm teaching and mentoring also in this field dentists of all around the world that go to my clinic, and they can learn a little bit of my way of treating this such difficult case, hard case.
I must say, I have been to his clinic in Fortaleza, and I found him just very approachable and just very generous in his knowledge. He has the patience to answer the stupid questions. So it works.
That's not the truth.
I'd really like to know, looking back, was it a defining moment that is decided that this is what I want to do? I want to get into atrophic jaws and I want to help these people. Was there a defining moment in your life, to lead you to this?
There was really a very personal event that made me migrate to this area. It was because I treated my mother. She was, my mother has a very poor childhood, and my father also. And they really struggled a lot to raise us as kids and to enter school and to pass to us all these important messages of how education is important, etc. So this is not the case, but because of this, when in Brazil and you live in such areas, they don't have money to spend with the dental treatment, so the main treatment is extraction. So my mother lost all her teeth very young, and she passed all her life in this situation. And then when I finished my postgrad, she was the first full arch patient that I treated. So I really, this was a defining moment to me, because I saw how I could change the life of my mother. My mother has at the time only 50, I think she was younger than me, and she was wearing a denture for almost all her life since the childhood, and it was possible. To be the instrument to change her life like that. Yes, to me it was a defining moment to start view with these patients with a different view. And we have, we really have the opportunity to change the life of the people. And this, to me, is of course we like to be paid for what we do. This is why we do. But if you can do this for the life of the people, of the persons, this is really very rewardable. So I think this was a defining moment.
Yeah, I love that. I've had a patient actually tell me once, you've got the best job ever. So there you go. And this was one of my full arch patients, upper and lower. So I think I remember that for life. So I agree with you.
That's good. That's good. And what is interesting, I'm sorry, it was at that time, I didn't do these treatments that you do today, like R4, R1X, and zygomatic implants, graftless approach. At that time, I did in my mom. I made a iliac crest graft.
Oh wow!
So I could. At that time, I still lived with my mother at home, so I could see how is the post-op period of somebody who got a iliac crest graft and how hard it is. So since that time, I started to think in better ways to treat these patients. And if I could go back today, I would certainly do zygomatic implants in my mother, and I think she would not suffer a lot how she suffered with the post-op period of a iliac crest graft.
Yeah, there you go. This just tells us why things in dentistry have kind of advanced to zygomatics more, because if people don't have bone, we don't have an option, and the iliac crest graft. Not a good idea, as we know. There's just too much post-operative issues. So brilliant. So in your view, how much of the surgical success comes down to technical skill, and how much comes down to judgment, planning, and mindset? What do you think is more important?
This is a very good question. It's a tough question to answer, but I think that skill you can train. Somebody you can have this gift of the skill, and of course you'll be a fantastic surgeon. But if you don't study, if you don't learn, if you don't go to training, if you don't do the hard work every day, you can have the best skill, but you don't will be the best surgeon. And for the other hand, if you can be a good surgeon and you can train the skill, but if you do really a hard work on planning, on treatment planning, on knowing really what you are doing, knowing the materials, looking for cutting edge training, you will be a very successful surgeon. So I think that I don't think that skill is less important or more important, but I think it's the combination of both that you do you a best surgeon. But you can rely just on skill. I know many surgeons that are very skilled, but they are not very smart. They don't plan enough. They do things. They try to do things very quick, and this is not the best way. I think you should have to have the both things, the skill together with the learning, with the planning, and etc.
I totally agree with you. I feel what happens is after having enough skills or after having enough experience, we tend to become blasé, and that's when things go wrong. That's why that planning and all the mindset, doing it the right way, no matter how much training you have or how much skill set you have, is important. I think that's a very good point there. For clinicians who have heard of Piezosurgery but haven't used it yet, what's the best place to start?
The best place to start is, first of all, is knowing what is this technology?
Yeah.
What is the difference for the rotary regular instruments that you use, and understand how this can be a good tool to our day-by-day practice.
Yeah.
In fact, dentists are using the ultrasound, which is a form of piezo, for many years, removing, cleaning the teeth and etc. So it's just another way of using this technology and understanding how this technology works, and of course looking for training, adequate training. They will start to see how this can add to your to surgical practice, and it has many advantages on it. I think it's important. It's not just about buying an equipment. You have to understand how to use it, because the technology you can buy, but you have to understand which are the principles and what this can add to your clinical practice.
So what's the big deal about piezo? Why piezo? Compared to rotary. Sorry.
Okay.
Yeah.
To me, what catch me in the piezo was the fact that, first of all, the fact that you can cut the bone without harming the soft tissue. This, for who works with big surgeries, make big difference. For example, if you are talking about full arch, when we do the reduction osteotomies to the reduction of the bone, osteotomies, when you use a drill or something like that, there's always a risk of damaging the soft tissue. So I myself had my cases in which the drill touched the soft tissue, so we have some kind of laceration and etc. So we can deal with this, but if we have a way to avoid this efficiently, it would be great. And this is exactly what the piezo gives to us. You can cut the bone, and so in reduction osteotomies, you cut the bone without the risk of harming the soft tissue. This is a great deal. In the sinus lifting, we can cut the bone without damaging the membrane of the sinus. And I used to do many cases of lateralization of nerve. To me, the piezo was a game changing.
Really?
When you do game lateralization, because one of the big risks when doing nerve lateralization is the drill damaging the nerve, even rupturing the nerve. And with the piezo, this is almost impossible. So I think that as a surgeon, this feature of the piezo. Besides this, you have best bone healing, for example. And so if you do a osteotomy to remove a tooth, a wisdom tooth, the healing, the post-op for the patient is better, because the damage for the bone is less than when you use a drill, for example. So I think there are so many advantages when using, and I think it should really be used by everyone.
That's beautiful. I don't think we use the piezo enough, honestly. I think it just lies above our surgical mora, and we don't use it as much unless we have a difficult extraction, and then we'll go, okay, piezo, maybe, but not an everyday use. That's in my case anyways, and I have quite a few dentists working with me, quite a few associates. I don't think any of them use a piezo, really. So I think that's something that we need to all kind of get into. For the sake of the patient and for your sake, because the patient comes back to you with post-operative complications. So, so yes, definitely. So we'd like to know more. In the evening, you have a seminar and you'll be discussing a lot more about piezo. So tune in. So next, we're going to talk about full arch and complex implant rehabilitation. So you've done quite a bit of work in those. I'm not even going to ask him how many cases he's done, because you'll all just feel low then. So my question would be, for full arch, the biggest thing is getting primary stability. So is there something in particular that you would say, in your opinion, what's the one biggest thing you can do to help make immediate loading possible?
Yeah. This is another very good subject. I like to talk about it because I heard someday from a colleague. I heard he was lecturing, a great professor in Brazil, and somebody asked him. Somebody said to him, "You are very lucky because you always achieve primary stability." So he said, "No, it's not a matter of lucky.
Lucky, no.
Yes, it's knowledge. So you have to know how to achieve the primary stability, and this I can say that it depends on your technique, your skill. This is important. Know where to place the implant and etc. It depends on your implant that you are using because the implant has to be the right geometry for achieve high stabilization torque even in a poor bone. So this is possible with the right implant. Using under drilling techniques. So you have always to under drill. This is very important. And another thing is this is recently added. It's the osteodensification, like the Versa drills, for example. I think this is a good tool when you anticipate that the good is really poor. So it's another tool that can help us to achieve. So I think that this shows that the knowledge is important. It's not lucky. You have to have the knowledge, the training, and the right tools to achieve this high torque stability. I think it's important to say that.
Absolutely. So you're lucky if you have the right skills. You're happy to work on it, do the proper treatment planning, and achieve it that way. Absolutely. Thank you. Let's talk about Zygomatics, the big deal here. So we'd love to know, he does a lot of Zygomatics, and you've actually managed a lot of failed cases as well, if I'm correct. So let's hear Dr. Sormani talk about Zygomatics now.
Okay. I started with Zygomatics in the old days, I'd say, with the Brennemark technique, which is pretty much intra-sinus. So we always pass it through the sinus. So we had a pretty bad experience with that because we have sinus issues, and also positioning of the platform issues. So that complications led us to abandon the technique, to leave the technique behind. So not that recently, but let's say 8 years ago, I started, knowing the extra-sinus approach with Professor Aparicio from Barcelona and Professor Melhorança in Brazil, and that I could see that it was a totally different technique. It was not that old technique from Brennemark. So I started doing cases with extra-sinus approach, and I almost had any case of sinusitis, of sinus issues that I have before. So I was pretty confident in using and adding this technique to my clinical solutions, let's say that. So I don't think it's an easy technique. You have, first you have to masterize the full arch standard techniques like on4, on-X, etc. But I definitely think that this is a tool that you must have if you want to give a complete treatment for the patient. And I think in the last few years that we are seeing many other techniques, raising together with zygomatic implants. We have transnasal, we have transsinus, and we have pterygoid implants, and a bunch of techniques that permit us let the zygomatic really as the last resource. And we can try many other different techniques and treat such hard cases in trustable way. I think so. I love this. I love these approaches.
I think a lot of us general dentists are very anxious when it comes to zygomatics, but really with the right training, it's all possible.
Yeah.
So I think that's what's needed. Not the scary bit, but the bit that yes, we can achieve it, we can do it. Just training, really.
Yeah.
That's what it is.
Yeah.
Every clinician encounters complications at some point.
Yeah.
How do you think dentists should view complications, as failures or a part of the learning process?
Oh, what a question! Very nice. I think I love to talk about complications. I know that, if you go to for example, today to the Instagram, you see such beautiful cases.
Oh, yes.
Everyone just posts the best cases ever. And sometimes you think, oh, only me have this complicated case. Everyone, just beautiful, wonderful cases, but my cases sometimes, and it's normal. There's a quote from Brenner Mark, and when he says the only surgeon that doesn't have any complication in implants is that one that don't place implants.
That's it.
Yeah,
absolutely.
I don't have my complications in endodontics is zero because I don't do endodontics. So.
I love that.
Yeah. So we have to deal with it.
Yeah.
And we have to learn from the complications. Yeah. Of course, what is not good if you have complications and then repeat and then repeat and then repeat. This is not good.
Yes.
But if you have a problem and you use this problem to grow professionally, the complications let you humble.
Yes.
I think that complications always let you humble. Keep you in the ground.
Keep you grounded.
Yeah,
yes, absolutely.
Yeah, this is important. And I always like to talk about. Almost always when somebody asks me or invite me to a meeting, what do you want to talk about? And I say I want to talk about complications.
Yeah. Because
I learn a lot and I want that the others learn with my mistakes. And today, fortunately, I do less mistakes, but I think I treat so many cases, so many complications from other colleagues that come to me. And it's always an opportunity to learn a little bit more about that issue.
Yeah, I think he's got the problem exactly where you should catch it. Basically, if there's a problem, don't just ignore it. No. Do your research after. So all the cases that I do as well, I would make a plan. I have a little A4 sheet of paper. I make a plan, and then after the case is done, any complications, I write them down. I read through my research papers, work out how to do it better. If I'm going to repeat that thing, that's stupid. Sorry, but that's stupid. So you've got to learn from your mistakes, and that's how you'd become a good clinician, right? Because we'll all have these complications at some time or another.
Yeah, that's right. To try to learn, it's as I said, you can't go keep making the same mistake. It's like this. They say that if you do the things the same way, you have the same result. So if you did wrong, you have to change everything and try to
absolutely
do it
100%. Yeah, I love that. How does a clinician know when to continue managing a difficult surgical situation, and when is it vital to stop and refer?
That is hard. I think that first of all, you should know what is your limit, because sometimes maybe you are having a trouble or a hard day or a complication because you've gone too far than you could handle. So at beginning, you should. This is something that today I see a lot. People don't want to learn step by step. The guy sometimes he's just a new grad and he wants to start doing advanced cases, for example. You have first to walk, then to fly. So you have to go slow, and don't try to do things that you are not prepared to. This is the first thing. But of course, occasionally you have situations in which even having a good preparation, something happen and then you can finish. But it's important. The important thing is, what I think is, I can really do this. If I feel that I can really finish that job, I will try until I finish it. This is the first thing. But the second thing is, I have to know if the patient is good, it's okay. And I always, if it's not under GA, if the patient is awake, I always asking for the patient, are you good? You can go further. You want to stop, you want to rest. This is important also. Yes. And the third is, if you have the equipments, sometimes you don't have the equipment. Sometimes your suction is not good. Yeah. Sometimes your light is not good. So in these situations, I think you should stop and refer for somebody that is well prepared, or if you want to do it in another environment, another setting. I think this is what is important.
I agree. Sometimes it's just, you just, this extreme exertion as well. It's a long surgery, and then your brain stops thinking. Yeah. Sometimes it's best to abort and do it with a fresh mind. Yeah. Or if you feel that's not the right case, kind of have some moment to think about it before continuing, knowing maybe you need to refer and have the heart to do so.
I totally agree. Just remember me one situation in which I was a trainee yet, and I had this surgeon that was my mentor, and I was struggling to do extraction, simple things, but at that time to me it was difficult. I was struggling, and he said to me, stop a little bit, put the gauze, I asked the patient to close the mouth, took off the gloves, and let's take a coffee. 5 minutes. Mm-hmm. And when I came back, in less than 1 minute, I strapped the teeth. That was a great lesson to me, because sometimes we are exhausted. Sometimes you can think the right way to remove it, and sometimes you go out, you relax, and you think better, and you are rested physically, and things can go better. And sometimes you can just delay for another day, for example. But a thing that I think is very important, it's inform the patient. This is very important.
Definitely.
You have to, to take the courage of always. You never must hide of the problem,
Yes.
And the patient must be informed about it.
I think that's a very important point Dr. Sormani's talked about. The patient must be informed what's going on. Whatever's happened, it's like you've got to tell the patient, and you might resolve it. You might get everything right and tell the patient, I'll take care of you. However, this has happened. Not informing the patient is probably one of the biggest legal issues that dentists tend to face. So be honest, just let them know, 100%,
And be honest and create an empathy with the patient. This is important.
Definitely. Patient is king.
Patient is king.
Pretty much.
Nice.
I think the next question is a really nice one, and I'd love your advice on this. You teach clinicians all around the world. What qualities do you notice in dentists who grow quickly and safely?
This is very interesting. Since I was teaching in the dental school, I was very curious for example, in 10 years, how these guys will be. And sometimes I looked for the students for certain characteristics, and some of them I think this will be a very well successful professional because he or she has these characteristics. This person is objective, this person is focused. She or he knows where he wants to be and he wants to go. And this is very important. You have to have a goal in mind. This is very important. And mainly they were person that they don't hurry. They don't jump steps. They look for training. They look for training with the best. This is very important. And today I can add another characteristic. I think the dentist of the surgeon must have. He must know a little bit about managing the business part of this.
Yeah.
This is, I think, is very important. I wish I would understand this before, because I'm struggling a little bit with this, because I always was just worried about the technical part. But if you are managing a clinic or a business, you have, of course, you have to have the best staffs to help you, but you have to understand the business part of everything. And in the end, you have to understand the patient is king. I love it, this. The patient is king. You have to treat the patient well. He's a human being. And so I think that the dentist that has these characteristics, you'll be successful in the actual world. I think this is
I think that's quite nice the way you've put it, like being patient and slowly building up and understanding what you're doing, and also having the empathy for the patients, because ultimately, if you can't get the patient in your chair and you can't get them to understand and don't have the empathy, you won't really have many patients. So to be a good dentist, you need practice, and for practice, you need patience. So that works. Empathy is really, really important. What still excites you most about this field today?
The future?
Yep.
I think the future in our field will be mainly digital. I think this is what excites me the most today. I think I'm an old man already. I'm like what they call a dinosaur, but I always looking for the new thing, the new technologies. I think that it's very important to be connected with this. And I'm not that kind of guy that say, in the past it was the best time. In the past I did like that. No, I think you have to be open to the new. And today I think the new thing is the digital. And we are still in the very beginning. You're just scratching the surface of what we're gonna happen. And you have to be prepared, and you have to be open to this. And you have to know that we can't deny this. We can't incorporate this for our practice. So I believe that human it will be, of course, the most important thing at the center. But you have to be able to and open to incorporate these new technologies. And I'm very excited with this. Very excited.
That's great. I think AI is going to affect these things as well. And there'll be lesser problems, lesser issues, better fit for all our procedures as well. There's so much more happening. I agree with you. So, all right, our last question. If you could leave our listeners with one message, what would that be?
My message is it's worth to do the things with ethics. It worth to do the things. It worth to stay humble, and of course, you want to be the best that you can. But it worth to be an ethics person. This is one of my great worries about today, to be honest, because I have a son that is in dental school, and I don't want him to go to dental school only thinking in gain money and be rich. I think that this is a consequence of a good work, but I think that what we should move the new generation is wanting to help people to have a better health, a better life, to be happy in the end, because this is the work of a dentist, is to make smiling, I think.
Definitely.
And this is what I let in to the new generation, to the persons, and always look for learning. Learning is never will be enough. Never will be enough.
One of my patients tells me, he goes to me, we are learning for a lifetime and we still die stupid. And yeah, I agree with you. I feel, I always tell my nurses as well, my patients as well, you know, if you give others enough of what they want, you'll get more than enough of what you've ever wanted. So, and ethically, of course. So, yeah, I think that's a very good way to end the conversation today. I think you were very insightful. So thank you so much. Dr. Sormani will be presenting tonight as well. So, yeah, tune in. Thank you so much.
Thank you, Dr. Sormani. I hope you enjoyed it.
Thank you.
Thank you.